Health Connection, medical assistance for all.
I'm Dr. Vanishree Pathak. I have a DDS qualification from the United States of America and a work experience of practicing in New Jersey. Overall work experience about 20 plus years. As of now, I am an associate dentist at Dr. Bhimsen's Family Dental Clinic in DLF Phase 1. Today I would like to talk about the most common problem in dentistry, which is cavities or caries. And it is the most neglected problem which we have come to see in the last many years. Usually it can cause a pain, or it may not cause any symptom to the patient at all, and that is one of the reasons why it is neglected by the patient. If a cavity is not filled at an early stage or the beginning stage, it leads to a treatment which is called the root canal treatment. Now, there are a lot of myths about root canal. A lot of people feel that it's very painful and it's a big surgery, but it is not. The fact is that a root canal procedure is a very simple procedure. It is a specialized yet a simple procedure which is carried out to save a tooth. In certain situations, when the cavity is very deep and it affects the nerve of the tooth cannot have a regular filling, and so a root canal needs to be done. Basically, our tooth looks like this. So this is the part which is visible and this is not visible. These are called the roots of a tooth. Root canal treatment is basically to treat the roots of a tooth. When the cavity or the infection reaches right till the end of the root, that's when we clean out the root from inside and fill it up. The root canal procedure usually is a one-sitting procedure unless there is a severe infection and there is pus. So then we leave it to drain out the pus and complete it in about 2 or 3 sittings. Usually a root canal takes about an hour and it is a one-sitting procedure. After a root canal, it has to be followed up by a permanent filling as well as a crown in order to protect the structure of the tooth. A root canal treated tooth should last in the patient's mouth for a number of years. Unless a crown is given, the tooth can break. So basically, my point of talking about a root canal is that one must not wait for that stage to come in a mouth, and get a preventive checkup done every 6 months so that a small cavity is treated with the filling and the whole procedure of a root canal is prevented. Because even though we save the tooth with a root canal, the life of the tooth does go down rather than being a natural tooth with a very small filling. So in future, if you even do not have a pain, advisable that a 6-month checkup should be done regularly to detect any problem which you cannot see but a dentist can see.
Medical disclaimer: the information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis or treatment. All content, including text, graphics, images, and information, contained on or available through this video is for general information purposes only. It is not intended as medical advice, and should not be relied upon as a substitute for consultations with qualified health professionals who are familiar with your individual medical needs. The whole sole purpose of this video is to make people aware of healthcare and medical knowledge and developments. We at Health Connection specially recommend you to visit an authorized physician nearby for medical opinion, medication, treatments or procedures. For more details, kindly visit our website www.healthconnection.in, or if you have any questions, comments or concerns, please do not hesitate to write to us at info@healthconnection.in.